Well, thank you all for coming to our fabulous outdoor venue for these events. This morning we announced that all students who come to our campuses will be required to be vaccinated by this fall, assuming that at least one of the vaccines currently authorized for emergency use is fully approved by the FDA, and that's really important. We will be providing opportunities for both medical and religious exemptions, as we do for the current health clearance requirements that have been in place for decades. We have a lot of details that we'll be working through over the time between now and the beginning of the semester, but we wanted to get word out there now so that our students would know they should get vaccinated and know that they will be coming back to a safe UH campus, whichever UH campus they attend. And we've had many inquiries from parents who are concerned and want to see a vaccination requirement so that they know that their child will be coming to a safe campus. I think with that, I'd be glad to take any questions.
I know there's a lot of details that still need to be worked out before the fall, but what is the running list of things that the UH still needs to figure out?
So we're working through, for people who have exemptions, what kinds of protections will be in place for them in particular. I think that's probably the biggest one. We also are initiating conversation with the three unions that represent UH employees, UPW, HEGEA, and UPA. We will see whether we can implement a vaccination requirement for employees as well. Right now there are, when I checked before coming down, 361 universities in the US with a vaccination requirement for students. That's across the country. That's a mix of public and private institutions. Less than half of those also have vaccination requirements for employees, but many do, and most notably the University of California system and the Cal State University system announced that their vaccination requirements would apply to both students and employees. So we want to do everything we can to make our campuses as safe as possible for all of our students and all of our employees and others who come onto our campuses.
Is there any reason why you wouldn't be able at this point just to go ahead and require employees to be vaccinated? Are there any sort of clauses in contracts or legal issues that
it's something that we need to discuss with the unions because it relates to their employment on our campuses.
One of the vaccines that's required, will that make a difference as to which of the vaccines the students
Any
get?
Any of the approved vaccines. In fact, if we have international students coming in with a vaccine that's been approved by the World Health Organization, but has not necessarily been approved within the US, we will accept that as well. The reason for waiting until at least one has been approved is we know that there are people who are concerned about being vaccinated with a vaccine that's only available under experimental authorization. And we want to make sure that those individuals have a chance to be vaccinated with a vaccine that has been fully approved by the FDA. And we will make sure that people who have not been vaccinated and for whom that is the obstacle, we'll make sure we can get them vaccinated with, at this point it looks like the Pfizer-BioNTech will be the first out of the gate to have full approval from the FDA, with Moderna not very far behind. That's our guess. And as best we can tell, that's likely to take place over the summer with enough time.
How will you go about verifying the authenticity of the vaccinations?
we'll be working through that process. We're watching closely the safe travels process, and we have a relationship, obviously with the state folks. They're able to do some automatic verification from the vaccine card, but we may also just ask people to show us their vaccination card. It may be possible to forge it, but we're not, we don't have a heavy belief people are going to be highly motivated to forge vaccination cards. I think many of the people who don't want to be vaccinated are comfortable asserting that.
Religious and medical exemptions do you have, and right now with other vaccines, and then
Right
do you
now
see a
it's
process for them later?
across the UH system, so over, I guess, about 48,000 students is about 960.
I mean, eventually, if there is a return to campus, would they have to get a COVID test?
So it will be an additional exemption request because the current exemptions, say from MMR or tetanus, those are specific to that particular shot. So we'll have a process in
excluded
place.
from online, or they would be excluded from on-campus activities.
They have not been, so that's one of the TBDs that we're working through, is to understand, what are the risks. And let me get their name right, the American College Health Association, so that's the name of the Association for Campus Healthcare Providers. They recommend student vaccination requirements. So we'll be looking to our national peers for practices, as well as our own. We've had a health and well-being working group with representation from the medical school, nursing school, public health, pharmacy school. So as we've navigated this past year, we've had really good guidance from our own internal expertise, as well as our conversations with the Department of Health, who've been really helpful as we've navigated everything we've done since last March.
Will spectators be required to be vaccinated for sporting events?
I'm sorry?
Will spectators be required to be vaccinated?
We haven't crossed that yet. We'll see. The guidance from CDC just came out last week, but what we believe is that I'll characterize it, this is my take, they gave us health guidance, but they didn't give operational guidance that anybody can really use just yet. But we think that'll be really helpful in understanding what it will take to return to some semblance of normalcy. And I think the quote from Dr. Char notes that, let me read it correctly, we're hopeful that with the new CDC guidelines and vaccination requirements in place for students, that by fall we'll be able to return to mask-free classrooms without physical distancing requirements. So it's likely that as we talk with them about attendance at athletic events, we can see where the handwriting is on that wall.
The school would be reopened fully for the fall.
Pardon?
Is the school going to reopen fully in the fall, all classes in person?
We have already published our course schedule. We actually published it in March. So this is one of the really interesting aspects of this pandemic, has been how fast things change and how fast we have to pivot. So we announced a schedule in March based on our expectations of masking, physical distancing. So we have a pretty heavy online presence. We're looking at how, with what we're announcing today and the new CDC guidelines, we think we can fit substantially more students into our on-campus classes. But we've got to navigate the fact that students have already registered with expectations of a certain modality. So we've got some ideas about how to increase our on-campus presence. One really easy example is we have a set of classrooms that we call Here and There, or Here or There, where we have students in a classroom with a faculty member on campus, and we also broadcast it out by Zoom, and we have students who can register in either. So we think that given where things are headed, will likely be able to increase the number of seats on campus, but also preserve the off-campus opportunity for those who have signed up for online classes. And one of the things we've learned is that students do want online opportunities along with their on-campus experience.
How many employees does the UH system have? And regardless of whether or not you end up requiring those employees to get vaccinated, are you now, and will you be tracking what percentage of your faculty are vaccinated, just for assurances for parents?
So we're close to around 10,000, and that includes, we have a lot of student employees as well. Every one of them has had a chance to get vaccinated, as now basically everyone in Hawaii ages 16 and up. And we will continue to encourage them to be vaccinated. What we will likely do is a survey, so we know who has signed up through our vaccination efforts, but we don't have data on people who just went to Long's or to HPH or to Queens to get vaccinated. So the only way we're going to be able to get that is through a direct survey, and we'll probably be doing that over the next month or so to get a feel for how actively we need to really promote vaccination and accelerate our Get Vaccinated UH program.
How do you anticipate enforcement will be? I mean, if I'm a student, how are you going to prove I'm vaccinated or not, and I go attend a class? How do you envision this enforcement?
I think we believe most of our students will be honest. We may have a process by which we ask them to show us their vaccination card. That's what we do with the TB test. That's what we do with the other vaccinations. And then we actually have a record in our student information system to show that they've had the health clearances. Again, we've had health clearances here for decades, and it's this one we're just implementing faster than the others. And we're very grateful. We recently were able to have the administrative rules changed so that the health clearance requirements only apply for people who come to campus. And if you're an online student and you don't come to campus, there's really no requirement from our perspective that you satisfy health clearance requirements. And we obviously have a lot more opportunities for online classes and online support services based on the work we've been doing over the past year.
I'm just wondering, it's up to the teacher to have to police that, right?
No, what we will be able to do, we believe, is make sure that everyone enrolled in an on-campus class has, in the student information system, has demonstrated meeting the health clearance requirements as we do now. Again, this is something we do now, and we know if you haven't taken your TB test or you don't have your MMR vaccination, we can hold your registration.
What are the implications for you in terms of planning for the fall school year if the Pfizer vaccine doesn't end up getting full approval this summer and you have to...
Then this requirement won't go into place.
But in terms of trying to open up classes for more...
Well, the only difference is we won't have a requirement. We're committed to not have a requirement unless there is at least one vaccine that is available that is under full authorization by the FDA. But everything else we do, we will do as we're doing now.